Kisoro district is prominent for being one of the leading food baskets in the country. Despite this, the Uganda Demographic Health Survey 2011 showed that the district ranks highly at 44% in having malnourished children. Dr. Moses Mutabazi, the district nutritionist based at Kisoro Hospital, told NBS Television that 51% of all children in the district are stunted, a reduced growth rate in human development.
If we find somebody is in red, that means he's severely acutely malnourished. So what we usually do is to admit that person for treatment, either OTC, if the person does not have severe other complications. But then if a person has complications, we admit them in the hospital under what we call inpatient therapeutic care clinic.
A policy brief by the Economic Policy Research Center titled Addressing the Poor Nutrition of Ugandan Children showed that malnutrition is widespread in Uganda but generally declining. In Kisoro, however, the problem is brought about by a general lack of knowledge by the population on how to utilize the foodstuffs cultivated every season.
We usually have mothers here, you interview them. When their children are sick, you tell them, tell me how you feed the child. Then they usually tell you, the best food here we have is Irish. So we give Irish because it's very good food. Then you tell them, continue, what else do you give? I only give Irish and bean soup to my baby. Now, when you look at Irish and bean soup, when the child is growing, what they really need a lot are proteins. But then you find they are feeding babies on what? Carbohydrates. Usually when we are feeding babies, we recommend you feed proteins to carbohydrates, a ratio of 2 to 1.
Tembo Stephen, the Chahi sub-county chief, says they are moving to households sensitizing parents on better feeding of their children.
One of the activities they have done at the village level is to teach these farmers, I mean the community members, that we should have kitchen gardens, fruits, greens, vegetables, which the children can feed on, including their mothers, so that the nutrition levels are improved.
The district is benefiting from the American-funded Strengthening Partnerships, Results and Innovations in Nutrition Globally Spring project aimed at reducing the high levels of malnutrition in Uganda and other countries.
We also do nutrition education in the communities. We counsel mothers on how to feed, and then we also encourage mothers when the children are sick to bring them immediately to the hospitals.
Rukoro village, Chahi sub-county, borders Rwanda. Here, the project is teaching residents on improving the nutrition of their children.
A kid might not be in need of this porridge the way it looks, and you want just to make it a bit lighter, because when you take it, the porridge becomes brown. So when you add in maize, it a bit becomes white. You see both ingredients, both the sorghum and both maize. It becomes more flexible for a child to take.
Habimana Hope, the Kisoro district focal person, says the leadership is working at encouraging the farmers to take up fruit cultivation to improve their diets.
In the Department of Agriculture, they are supplying apples which are fruits. And that's one way, that's in nutrition. In education, we are advocating for midday meals.
The World Health Organization indicates that malnutrition is associated with almost a quarter of all maternal deaths. Such preventable deaths reduce Uganda's gross domestic product by about 4.1%, costing US $310 million lost in economic productivity every year. Report compiled by Tyaba, Abubakar, Ssettumba for NBS Television, Sunset News. Malnutrition is a major demographic challenge to the cold mountainous Kabale district. The pediatric ward at Kabale Regional Referral Hospital is ever busy as it is occupied by 6 malnourished children on a daily basis. Sister Akurut Christine, the principal nursing officer, says the malnutrition is caused by poor cooking methods and food lacking in essential nutrients. The most common foodstuff here is Irish potatoes, beans, matoke, and peas.
When you look at the kind of food that the people in Kabale produce, it is perishable food apart from maybe the beans. So I think the problem is with the food. There is not adequate food really that they can preserve. Their foods are mainly perishable. They grow Irish potatoes, they grow cabbages, beans on a little scale.
They are preparing the food as usual. But when they are preparing, they just look at the children, what the children likes, and that's what they depend on.
The Uganda Demographic Health Survey 2011 showed that in Uganda, 1 in 19 children die before their first birthday and 1 in 11 die before their 5th birthday, and malnutrition contributes to 60% of these deaths, making malnutrition one of the most significant contributors to child mortality in the country. In Kabale district, the problem is compounded by a lack of cash crops, with the population having to rely on the selling off of the cultivated cash crops for income.
I think they have commercialized the thing so much. Most of the food that is produced is actually sold other than being consumed in the families. Sometimes when we get out into the field there, you find trucks in the gardens. As the people are putting the Irish potatoes, there is a truck waiting.
Kabale Regional Referral Hospital handles the 4 Kigezi sub-region districts of Kisoro, Kabale, Rukunjiri and Kanungu.
Our catchment area is 4, that is Kisoro, Kanungu, Rukunjiri and Kabale. We get a few cases from Kanungu. The patients and the caretakers within Kabale find it easy to come to Kabale Hospital. There could be many out in the other districts and they are not coming. But the number that we get here, majority of them are from Kabale district.
Kabale district is most affected by the problem, with most admitted patients lacking proteins necessary in fighting kwashiorkor.
It is mainly protein energy deficiency, malnutrition.
The hospital from the American-funded Strengthening Partnerships, Results and Innovations in Nutrition Globally Spring Project is sensitizing mothers on how to safeguard against malnutrition in their homes.
They also train village health teams because we also work with the community such that those people are able to assess people who need some support in as far as nutrition is concerned, and they refer them to us here at the hospital for management. So basically, and we've been in touch whenever there is anything that we do not understand. We've been contacting them and they have been supporting us.
Unfortunately, many cured children are usually readmitted after a few months.
You get children, we rehabilitate them, they recover, they get home, and in about 3 weeks, 1 month, you may be able to see the same child. So we actually feel that the problem is down in the community.
The country is currently implementing a 5-year plan dubbed Uganda Nutrition Action Plan 2011 to 2016. But with roughly 1.5 years to its end, much more needs to be done to secure Uganda's future. Bushra Namirimo, Tyaba, Abubakar, Ssettumba for NBS Television, Sunset News. Ntungamo district is a major matoke producer. The district also boasts of expansive ranches that supply Mbara municipality and Kampala with high-quality beef and milk products. It thus comes as a surprise that the district is having high numbers of malnutrition, including stuntedness. Atwine Esther, the district production officer, blames this on a lack of cash crops, with families selling off all their produce to raise funds for other activities.
Even those that have the food, they don't know how to prepare the food. You find a person selling all the beans she has just harvested in order to get school fees for a university student. And in Ntungamo, education is given the first priority.
Most of the malnourished children find their way to Itojo Hospital. Kezabu Majoli Mugisha, the nursing officer in charge of the pediatric ward at the hospital, says most parents lack basic knowledge on feeding, explaining why children lack the basic nutrients necessary for their development.
And you prepare one good meal for these children, for the whole family, but you don't care about the child. Maybe you don't put it in your head that this child may benefit from a special meal. For example, we have the milk, but we prefer to sell this milk and we get money, and we don't put aside the milk for the child.
There are wide divergences in stunting rates by sub-regions. In 2006, only 22% of children in Kampala were stunted, while the corresponding rates for southwestern Uganda were 49.6%. According to experts, such differences can only be minimally attributed to income. In 2006, the sub-region with highest stunting rates, southwestern Uganda, had a much lower incidence of poverty than, for example, North or West Nile sub-regions. Kezabu Mugisha and Ruben Kamuhangire, the in-charge Rashamaire Health Center force, say there is also a general lack of information on nutrition among the health workers. The American government-funded Strengthening Partnerships, Results and Innovations in Nutrition Globally SPRING project has undertaken to educate health workers on the management of malnutrition in the district. But for now, the problem is still a great concern to the district. Bushra Namirimu, Tyaba, Abubakar Ssettumba for NBS Television, Sunset News.